What happens during the ICSI procedure for fertility? Imagine a process that can help overcome some of the toughest hurdles in fertility treatment. Intracytoplasmic sperm injection, or ICSI, is a specialized technique used mainly when male fertility factors make natural conception difficult. It involves directly injecting a single sperm into an egg to help fertilization happen. This method is often combined with in vitro fertilization to give couples the best chance of success. The first step in ICSI is ovarian stimulation. The woman receives hormone treatments, usually with follicle-stimulating hormone, to encourage her ovaries to produce multiple mature eggs instead of just one. This process takes about a week to 2 weeks and requires regular monitoring through ultrasounds and blood tests to track how the follicles are growing and when the eggs are ready. Once the eggs are mature, they are retrieved through a minor surgical procedure called transvaginal ultrasound-guided follicular aspiration. During this procedure, usually under light sedation, a thin needle is inserted through the vaginal wall into the ovarian follicles to gently aspirate the eggs. The eggs are then collected and placed in a special culture medium in the laboratory. On the same day as egg retrieval, the male partner provides a sperm sample, which can be collected through ejaculation. If necessary, sperm can also be retrieved surgically from the testes in cases of severe male infertility or vasectomy. The lab then processes the sperm, selecting the most motile and healthy ones for injection. The core of ICSI involves using a very fine glass needle and a microscope to inject a single sperm directly into each mature egg. This step bypasses many natural barriers to fertilization, such as poor sperm motility or abnormal shape. The embryologist carefully selects the best sperm and injects it into the center of the egg, called the cytoplasm. After the injection, the eggs are observed in the lab for signs of fertilization. Usually, fertilization occurs within 16 to 20 hours. The fertilized eggs, now called embryos, are cultured for several days, typically 3 to 5, to allow them to develop to a suitable stage for transfer. When the embryos reach the right stage, one or more are selected for transfer into the woman's uterus. This is done with a thin, flexible catheter inserted through the cervix, and the procedure is generally quick and painless. Any remaining high-quality embryos can be frozen for future use. About 2 weeks after the embryo transfer, a pregnancy test is performed to see if the embryo has successfully implanted in the uterus. If pregnancy is confirmed, ongoing medical care follows to support early development. In cases where women have conditions like endometriosis, ICSI can be especially helpful. Endometriosis may affect egg quality and ovarian function, making natural fertilization more challenging. While ICSI does not treat endometriosis directly, it can help bypass some of the barriers caused by the condition, especially when combined with other fertility treatments like ovarian stimulation and embryo transfer. ICSI is considered a safe procedure when performed by experienced specialists. Risks are generally low but can include ovarian hyperstimulation from hormone treatments, minor complications during egg retrieval, and the small chance of genetic or developmental issues in the embryo. It is important for couples to discuss these factors with their fertility doctor to understand their specific situation. In summary, ICSI involves stimulating the ovaries to produce multiple eggs, retrieving those eggs, selecting the best sperm, and injecting each sperm directly into an egg. The resulting embryos are cultured and then transferred into the uterus, offering a powerful option for overcoming specific fertility challenges, especially those related to male factors and conditions like endometriosis. Always consult with a fertility specialist to explore the best approach for individual needs and circumstances.